Now, Dr. Aznavour, you have been talking about in another video about the different stages of periodontal disease, gum disease, gingivitis, and stuff like that. Now, why don't you tell us a little bit about the different types of treatments, under which name they are known, what it takes in terms of money, what it takes in terms of, basically what are the advantages, what is the procedures there available to fix it, and if we fix one, the other one will never happen, something like that, I guess.
Okay, yeah, there's a few ways of treating it. Usually we start with the least invasive and go to the most invasive. You don't want to start with the most invasive. And what we generally do is when a patient comes into our office, we generally look at their gums. We look at pockets is what it's called. Now, what is a pocket? A pocket is when we have the top of the gum to the bottom of the gum, the depth on the tooth. And usually it starts as gingivitis. Usually you want to have about 2 or 3 millimeter pockets in your mouth. And when it progresses to about 4, 5, 6 millimeters, it's becoming very dangerous because you're losing more bone in terms of periodontal disease. And gingivitis usually will be about 2 to 4 millimeters of pockets, and then you progress to mild periodontitis, moderate periodontitis, and severe. Now, severe periodontitis is when you have about more than 7 millimeter pockets, your teeth are moving, and the teeth have to be extracted, or at least a number of teeth have to be extracted. Moderate periodontitis is something that in terms of mobility, your teeth don't move too much, but you have pockets of about 6 millimeters, 6 to 7 millimeters. And mild is about 4 to 5 millimeters. And of course, each person is different. And what we look for is, what we start with is when a patient comes in, the first thing we do is if we see any deep pockets, 4 or 5 millimeters, the first thing we prescribe is a deep cleaning. Now, what's a deep cleaning? A deep cleaning is when we go in there, we numb your gums, okay? We usually will do one half of the mouth, the left side or the right side, and we do a deep cleaning, meaning we go underneath the gums, we don't cut the gums, we go underneath the gums and we remove any plaque that is there or any causative inflammatory reaction that's there. We remove it, okay? We smooth out your teeth, okay, which is called the root planing. And then sometimes we tend to put some antibiotic in your gum, either chlorhexidine or Arrestin. These are antibiotics that will help reduce the inflammation, to help you heal better. Usually, healing time, it takes about 4 to 6 weeks for proper healing. And what's the next step? Well, usually we recommend some form of treatment by a periodontist. What's a periodontist? A periodontist is a gum specialist. After 4 to 6 weeks, sometimes some teeth, the gums will shrink to the point where it becomes 3 to 4 millimeters, and then we'll put you on a recall schedule to come in every 4 months or 6 months, depending on how your hygiene is. You come in and we continue cleaning, and we just monitor as to if you're getting the gum disease or have we stopped it. Now, periodontal disease is not reversible, but we can stop it with appropriate treatment. In most cases, it is genetic. In most cases, it is due to a host of other diseases such as diabetes, very common. In addition, if we do refer you to the periodontist may do some form of gum surgery or what's called pocket reduction therapy. Because, for example, when you brush your teeth at home, if you have a 2 millimeter or 3 millimeter pocket, you are able to maintain that with regular flossing and brushing. But if you have a 6 millimeter pocket, no matter what kind of brush you use or floss, it's never going to get to the depth of the tooth. And that's why we prescribe what's called a pocket reduction therapy. And that's when the periodontist will reduce your gums so that they are not so inflamed, so that it can help you clean your teeth and reduce the risk of the gum disease returning.
Okay, so let me see whether I understood this correct here. So, normal pockets, 2 to 3 millimeters, something you can maintain with everyday cleaning, flossing, and of course with going to the dentist every 3-6 months, as the dentist describes, right?
Correct.
And usually for that cleaning, no injections is needed. You just, the dentist scrapes off the things with the metal instruments, and you're fine again. No inflammation for all purposes is there. Am I right?
Right, that is correct.
Good. When this progresses to 5 or 6 millimeter, give or take, then you need to do a little bit of deep scraping, where the person might need already an injection, which is called a deep scale cleaning, where you really, go in, but you're not really cutting the gums yet, but you're scraping out quite some dirt and some garbage which is in there, almost like the chicken under the carpet left, and there it's kind of growing,
Exactly.
Yeah, and at that moment, the person already has, in most cases, infections in it. Am I correct there or incorrect?
No, that's correct.
Okay. So,
that is correct. The plaque that accumulates is all bacteria, and the bacteria is what's producing the plaque in addition to your saliva. So it's a colony of plaque and bacteria. The bacteria is in the plaque. So it's very important to remove it, because you have a foreign substance in your gum. I mean, what happens? Your body is going to react to it by having your gum swell up, causing it to bleed, because the inflammation is there, and that's why you get inflammatory reaction. That's why it's called gingivitis. You have foreign substance there that should not be there. Either you're not flossing properly, or you're not going for your regular checkups to get the cleaning done properly, and that's what will cause your gums to continuously bleed all the time.
I see. So that's why sometimes patients come to a dentist for a cleaning, and the dentist says a cleaning doesn't do the trick anymore. We need to do a deep scale cleaning, which usually costs 3 to 5 times as much as a normal cleaning. Am I right there?
Yes.
And
that's correct.
And the patient throws the hand up and goes, "Hey, all I want is a cleaning." Tell me, at that stage, even a dentist cleaning simply doesn't do the trick anymore, just like the flossing and brushing wouldn't do the trick anymore. Is that correct?
That's correct. That's very correct, because it's only masking it. It's only kidding yourself. All you're doing is cleaning what you already see, and you're just putting everything under the rug, You're just trying to avoid the problem that is there. And that is something that's very dangerous. And like I said, the number one cause in tooth loss is gum disease. It's just like, waxing your car without washing it. What's the point?
I see. So it's a little bit like with the bills. If I only look at the bills if I open a bill and look at it, meaning if I take it and throw it away without looking at it, that doesn't mean the bill isn't there anymore, right? The creditors are still going to come.
It's going to come back to haunt you.
Yeah, they're still going to come back to haunt me. Okay, well, and that should kind of shade some light on it. That should make it very important. Now, since we're on that subject of cleaning, my dentist, I remember not one, but since I travel a fair amount, so several dentists have always told me, "Helmut, you need to go to a dentist every 3 months." Maybe because I'm not really all that good in brushing, like my wife brushes about, 4 times as long as I am anyway. But mainly they said I have lots of saliva, and they keep telling me, that's actually a good thing. You're very healthy having lots of saliva. You just have a little side effect of building up blood faster than a guy who doesn't. True, not true? What's the deal there?
That's very true, and that's what happens in my case. I have a lot of saliva. I do get more plaque than normal. But what happens is saliva acts like a buffer. It prevents your mouth from becoming too acidic for bacteria to flourish. So what happens is when you don't have saliva, your mouth becomes dry. You don't have that much plaque, but you start getting all these cavities. And so what does the saliva do? Yes, the saliva produces calcium. It's got calcium in there. It causes more plaque, but in turn it protects your teeth because it prevents your mouth from becoming too acidic. And that's how your teeth become destroyed. It's from the acid environment that the bacteria produce. So the bacteria, when they eat food or whatever they produce what's called lactic acid, and that's what destroys the teeth. And when there's no saliva, it becomes more and more acidic. So what does the saliva do? It acts like a buffer, It prevents your mouth from becoming too acidic. Yeah, you tend to produce more saliva, but the advantage, of course, is that you're not going to get cavities as much as a person who has dry mouth.
Well, wonderful.
And yeah, each person is different. Some people have to go every 3 months. Some people won't go for a number of years and they have, great clean teeth. It's very important, your home hygiene, but there's, of course, it's not the only factor. There's genetics, which plays a big role, and, of course, home hygiene and your saliva. Very important.
In the end, I guess the story is you don't really know before not a professional looks at it, so to say, under the microscope, literally, and sees what it is or what it isn't, and then takes action from there.
Yes.
Well, wonderful. Well, Dr. Aznavour, it was again nice talking to you, and I hope it was helping some people.